Oh, I can't use this. Oh. A nurse practitioner is a registered nurse who has completed a more formal education that allows her to provide further care to patients. All NPs must complete a master's or doctoral degree program and have advanced clinical training beyond their initial professional registered nurse preparation. All nurse practitioners must then sit for a national board examination and then apply for advanced practice licensure. They also must be accredited through either AANP or AANCC. Nurse practitioners can then prescribe medication, examine patients, diagnose illnesses, and provide treatment much like physicians do. In fact, nurse practitioners do have full practice authority in almost 20 states, which means that they do not have to practice under a physician. The other remaining states are in the process of acquiring this full practice authority, but some nurse practitioners still have to have a supervising physician or a collaborating physician with either a written or oral contract. Those that can practice independently are allowed to open up their own independent practices and have more autonomy with doing so. Nurse practitioners differ from physician assistants in that their schooling is much different. Nurses learn from a nursing theory perspective, while PAs learn from the medicine side. Nurse practitioners focus on theory, holistic care. The nursing process is emphasized and expanded upon. Nurse practitioners also have some more autonomy and can practice more independently based upon where they live. They get to focus on pediatric, maternal, or psychiatric specialized degrees, as well as acute and family practice. PAs, however, have the opportunity to expand and specialize in much more arenas. Nurse practitioners need to be recertified every 5 years or less, depending on their credentialing organization. However, they do not have to take boards again. They must complete, I think it's about 75 to 150 hours of continuing ed. 75 of those need to most of the time be from pharmacology. PAs need about 100 hours of continuing CMEs, and they do have to sit for boards every couple of years. The difference between doctors and nurse practitioners. Doctors attend a 4-year medical schooling. They then sit for examination of a certified medical board examination. From then, they will go to their internship and residency. Their schooling is probably between 10 to 11 years. There are 4 different practice settings listed by the American Medical Association: private practice, private group practice with equity ownership, group clinic, hospitals or healthcare, and then an academic institution. Doctors must renew their boards and license every 1 to 3 years with 20 to 50 CE hours. They can practice independently wherever they are. They don't need any supervision from anyone else, and they do not have any prescription exceptions. They can prescribe whatever they'd like in all 50 states. Nurse practitioners do have to apply for prescriptive authorities, and they have to be able to show that they've gone through all the completed education and health assessment courses needed to prescribe. There are some limitations to what a nurse practitioner can prescribe. Most of them are not allowed to prescribe Schedule II medications unless they're working in the hospital system. Why don't I become a doctor? I didn't even know that I wanted to become a nurse practitioner, but I do love my job. I love the autonomy that I have. I love caring for my patients at this level. I also love being able to separate my life from my job. I don't want to be just a nurse practitioner. I want to be a mom, a wife. I want to be myself and have my own hobbies. I've seen many physicians that don't take time for themselves. They work all the time in the hospital, 7 days a week, 10 hours a day, barely make time for their family. That's not what I want. I want responsibility, but I want it to end at a certain time.